Thank you very much, Kath. All right, so I am from the START Network, a network of 42 agencies, which aims to lead innovation in the humanitarian sector. And we're trying to solve some of the systemic problems that the sector has, and financing is one of them. The current problem is that the humanitarian system looks a little bit like this, a begging bowl, whereby individuals and governments make voluntary contributions to fund humanitarian responses to allow civil society to respond. However, these contributions often only start to flow in when we see these types of images, which I'm sure you're all familiar with. And by this time, people have already died, livelihoods have been lost, and development goals have been set back massively. And so the humanitarian financing system as we know it is fundamentally reactive. And it means that by the time money comes in, often 6 months after a crisis has declared itself, there's not even enough money to actually meet the needs that have grown exponentially. And at the START Network, we'd like to change that. We want to move to a humanitarian funding system which allows money to be released more quickly. And that allows for activities to be implemented which actually protect people and therefore mitigate the impact of crises. And therefore we want to be saving lives in that way. And the solution we're proposing is called disaster risk financing, which is based on 3 key components: science-based risk modelling, contingency planning, and lastly, pre-position financing. The science-based component is around building a scientific model which can predict a risk of occurring, and it can predict its frequency and its severity. And we do that by understanding specific triggers. And by monitoring these triggers, we're able to see whether this risk is in the process of materializing. That allows us to put in place ahead of time plans, which we call contingency plans. And these plans are around putting in place activities which can protect people from this risk which is emerging. So, for example, in the case of a drought, it could be activities to distribute fodder so that cattle doesn't die, or it could be transferring money to households so that they can buy additional food, or they could buy additional water. So we're able to put together plans which are costed and fully budgeted based on different scenarios of severity of an event. We therefore now know for specific events of specific severities how much money we need to put in place these activities. And then leaves the easy bit, right? The money bit. And this involves looking at layering different financial products which we can draw upon for different frequency and severity of events. So for something that happens very frequently but is not very severe, an NGO may opt to use their own internal funding to respond. But when the event is a bigger scale, NGOs may opt, for example, to draw on a national contingency fund, which could be made available to different types of organisations. But having money sitting in a bank account, that may work for smaller scale events, but it's not practicable if I'm asking you to set 10 million aside and just leaving it sat there in case. And this is where we move to a new product, which is new to our sector and has been existing for a long time, which is insurance. The START Network, for example, in the case of a drought, could take out an insurance policy on behalf of its members. The insurance policy would automatically pay out if certain triggers are met, for example, if rainfall falls below a certain value. Then we, as the START Network, receive the money automatically, and it's money which is pre-planned based on different severities will receive a pre-planned amount. And then we can allocate that to the START members to implement the already costed contingency plans. This approach is different because it solves the predictability issue. We know exactly how much money we're going to get for different severity of events, and we've got the budgeted plans to meet those needs. It also allows us to get funding up to 6 months earlier compared to traditional humanitarian action, and so we can put in place these protective activities. And research shows that £1 investing in these types of protective activities is equivalent to £4 in traditional humanitarian response. The START network has designed one such product which brings together a national contingency fund and a drought insurance premium to respond to drought risks. And at the moment, we've put together this pilot for 2 countries, in Zimbabwe and in Pakistan, and we're actively fundraising to launch this project. But our ambitions go much further than this. We'd like to have a multi-country drought financing facility that allows us to diversify risk, because drought may happen in one side of the continent but not on the other. And we also want to move away from droughts and actually look at all the other types of risks which can be modelled, such as floods or pandemics, for example, and we'd like to have financing products for those. And what we want is for all of these types of products to connect into a global infrastructure, which we're calling the START Financing Facility, and we're going to start the design process this year. Thank you very much.